Prof, thanks so much for joining us. I know that you watched that presentation, which was completely fascinating. I mean, I think that the scientists did an incredible job of explaining something very complex in quite simple terms. And it's a bit of a mixed bag, really. So it's good news that it's not more severe, but it is definitely more infectious. And that means the pressure on our hospitals is massive because more people are getting it more quickly. Just explain why this is a problem at the hospital level for us.
Thank you, Sally, and greetings to your viewers. So just to clarify, so I wouldn't call it more infectious, I'd call it more transmissible, because it just means that it moves very quickly through the population, and that's what they have demonstrated. And I think in the last briefing, they had not confirmed that. So now they're saying around about 50%. More transmissible, and certainly that was a big question whether it's more severe, and they have demonstrated with different types of data that there is no evidence to suggest that it causes more severe disease, which is a big relief. However, because it's highly transmissible, what it does, they spoke about how in the hospitals you get this sort of rapid increase in the number of infections at a very rapid, in a short space of time. So that builds a lot of pressure on hospitals. And the consequence of that is that even though you don't have more severe disease, you end up with large numbers of patients. And this has resulted in increased mortality. And they gave us percentage. I mean, at the Western Cape, it was like 80% increased mortality, which really is very serious. Not necessarily from the virus itself, but from the speed at which it moves and the pressure that it puts on hospitals.
Just explain to me, you said that I shouldn't use the term more infectious, but rather more transmissible. I mean, I could just say more catchy, but I'm trying to be, I'm trying to be formal. What is the difference between something being infectious and something being transmissible? What's the difference?
Yeah, so if you think about it, when you say it's more infectious, it's almost as if the virus itself has evolved in such a way that when it becomes, it's more, when it gets into the body, you get this sort of rapid infection in the body and rapid spread in the infection. But actually, that's not what we are referring to. What we are saying is that it's more efficient. It binds better. It's still the same virus, but it binds better. So some viruses, for example, like smallpox and all these other viruses were known to be very infectious, like MERS, for example, is known to be highly infectious. So, but these ones, it's more the fact that it's become more efficient. And so we try to make those distinctions, which is why it's better to stick with more transmissible than more infectious.
I think the part of the briefing, apart from the worry about the fact that higher numbers of deaths are happening purely because our hospitals aren't necessarily coping. They are running out of oxygen. Doctors are having to make terribly difficult decisions about who to treat and who to make wait. But the other thing that was very concerning is about the antibody response. And I'd love you to try and break that down just a little bit more and correct me if I've misunderstood it. But my understanding is that if I have antibodies from the first wave, there's a 50-50 chance that I could be exposed and contract this new variant second time around. Is that correct?
That is absolutely correct. And that 50-50 was a key finding because it was quite particular. And I think earlier you also indicated that you are much more likely to be protected if you've had more of a serious disease or you've been admitted. But if you've had a mild case, you see, it seems like there's an increased chance that a person can be reinfected in this case. And
that's really important, that distinction, because I mean, for someone like myself, I've been told I have the antibodies. I have no idea when I may have had COVID-19. So I might be someone who could be very susceptible to the new variant because I had mild to no symptoms.
Absolutely. But remember also that they qualified this to say that this is based on data from the laboratory, not necessarily from clinical data. They're still looking forward to seeing what the clinical data shows.
That's true. It was very interesting what Prof. Koleka Mlisana said, that they have noticed, according to the testing rate, 4,000 cases at least of reinfections. But of course they don't know if it's the first variant or this latest variant.
Yeah, so that was an interesting, it was a difficult concept to comprehend in terms of what she was explaining. I think the most important thing is that they have seen evidence of reinfections. But what she's saying is that it is very constant over time. You're not seeing a situation where all of a sudden we're seeing a rapid increase in reinfections. And because we're not seeing that uptick, that's what she was saying, that actually it does not necessarily mean that there's an increased risk of reinfection. The reinfections are there, but they're constant. Yeah. And that's what she was trying to convey.
However, she did make the point that it's early days yet. We've only really known about this new variant since December sometime, so maybe November, December, it's been in circulation. I want to move on to the province that you're in, Kwazulu-Natal. We know it's one of the areas that has really been hit hard by this new variant, but we also know with the health minister visiting today, he is seeing signs that the infections are dropping. Is that countrywide? Is that mostly KwaZulu-Natal? Just give us an idea of whether we are over the second wave, almost over the second wave, not sure. What is your sense?
Sally, what I would say is that we are in the peak nationally at the moment, and we've noticed something interesting this time around, that by this time, because Eastern Cape started first, we were supposed to have been seeing a clear downward trend in the Eastern Cape and maybe in the Western Cape as well. But it looks like they are slowing down, they are going down at a much slower pace. And so the KZN is just kind of going over the peak, and it's kind of coming down. It looks like it's coming down fast, but we expect that it may also slow down like the other provinces. And so what it does is that instead of seeing a curve that goes up and down, you start to see a broad base, which means that it takes a long time for the whole wave to end. But actually, the number of cases on a daily basis start to decrease, new infections start to decrease. So we're very hopeful that KZN, the trend we are seeing of like a downward trend, can be sustained. Now and then you see a little bit of a tick and you worry whether that's going to be just short term or is going to be sustained. What I often worry about is that we assume that the trend will always go down, but that's not guaranteed. It's possible that something might happen that actually triggers more of a continued infection. So we worry about that.
And I think that's such an important point you're making. And it reflects also what Professor Tulio de Oliveira was saying towards the end of the briefing, is that they so worry about mentioning that we are that infections are declining because complacency comes in. And as you say, it seems that the infections are declining very slowly. And if we look at other countries like the USA, a second wave can give way to a third and a fourth wave. So we have to be so careful, don't we?
Yeah, no, and we've seen that pattern in a lot of places, and that's why we worry about it. So we saw it in the UK, we saw it in Portugal. In fact, in Ireland, it was even better because it came all the way down. And when we thought that, okay, now they've gone over their second wave, then we started to see a new trend of a third wave. US, they were also always up, similar to the UK. So we must not take it for granted that because we are seeing a downward trend, that we are out of the woods. Which it does offer some comfort because that peak comes with a lot of people who are infected, a lot of people dying, and we want that to kind of ease off. But at the same time, I think that for us to see a downward trend, we need to kind of maintain some of the interventions that we have in place.
Prof, thank you so much for your time, really giving us some fantastic insights into that briefing that we have just heard. That was Professor Moshabela. Now, he's the acting Deputy VC in charge of research and innovation at the University of KwaZulu-Natal.